Okay guys, let's talk about meningitis. This is Dr. Nesco reviewing Toronto notes. So meningitis, first of all, we are going to the etiology. In a pediatric viral enterovirus, human paravirus, and HSV. Bacterial age-related variation in a specific pathogen, fungal and parasite meningitis also possible, and most due to hematogenous separate or direct extension from a contagious sites. So one of the things which is so important here is the route of infection, especially for Neisseria meningitis, which is touching of the surfaces, and situs which is contaminated with Neisseria. So the risk factors are unvaccinated, immunocompromised, like asplenia, diabetes mellitus, HIV, and prematurity. Recent or current infection like in acute otitis media, sinusitis, orbital cellulitis, and neuroanatomical defects or congenital defect, as we say, dermal sinus, and neurosurgery, cochlear implants, recent head trauma, and we have exposure to the surfaces, and we are going now for mainly for clinical sign and symptoms. So sign and symptoms variable and depending on the age, duration of the illness, and host response to the infection. Infant: fever, lethargy, irritability, poor feeding, vomiting, diarrhea, respiratory distress, seizure. And in children, we're having fever, headache, photophobia, nausea, vomiting, confusion, back and neck pain and stiffness, lethargy, irritability. Those are the history or sign and symptoms. And physical examination in an infant: toxic, hypothermia, bulging anterior fontanella, respiratory distress, apnoea, petechial, purpuric rash, and joints. So in the children, toxic, decreased LOC, nuchal rigidity, Kern sign, and Brzezinski sign, focal neurological finding, petechial and purpuric rashes. So here, Brzezinski sign and Kern sign are so important, and the neck stiffness, which most of you know about that, what is important about the examinations. And the investigations, we're going for CBC, electrolyte, creatinine, BUN, glucose, and others. So the something which is so important is lumbar puncture, required for definitive diagnosis. So gram staining, bacterial CS count and differential diagnose, RBC count, glucose, protein concentration. So glucose and protein concentration, so important. We have RBC in the lumbar puncture, or white blood cell, and neutrophils even. So here in the graph or table, we see lymphocytes, neutrophils, glucose, and protein. So we have normal for child and for newborn. In a bacterial meningitis, viral, and tuberculous meningitis. So the most risk factors for tuberculosis meningitis, it is prior infection with tuberculosis or maternal disease, or infected with tuberculosis or like exposure to the tuberculosis in a pediatric. So this one is seems to be rare, but viral and bacterial, especially Neisseria, is more common. So in a management, supportive care, preservation of adequate cerebral perfusion by maintaining normal blood pressure and intracranial pressure, close monitoring of the fluid, electrolytes, glucose, acid-base disturbance, coagulopathy, and we are going for bacterial meningitis. If suspected or cannot be excluded, common empiric antibiotic therapy while awaiting culture, or if lumbar puncture contraindicated or delayed. So if you know the patient has meningitis, and it will take for a while to get the definitive diagnosis, you're starting with the bacterial therapy. And in Haemophilus and influenza type B meningitis, we are using dexamethasone, and even in pneumococcal meningitis also we are using considers for those more than 6 weeks with a pneumococcal meningitis. So we have antibiotic therapy down. Here is it. In group B, Streptococcus, E. coli, Listeria, and gram-negative bacilli, we are using ampicillin plus cefotaxime, and in overlap of the neonatal pathogens and though seen in older children, cefotaxime plus vancomycin can be used, or ampicillin if immunocompromised. And in Streptococcus pneumonia, Neisseria meningitis, and Haemophilus influenza, we are using cefotraxone and vancomycin. If the patient has allergy, we are using vancomycin and rifampin. So here are the complications: mortality, acute situation like subdural effusion, empyema, brain abscess, and some other like hair loss and some neurological disturbance and like seizure disorder and hydrocephalus. So in a viral treatment, we have mainly supportive and acyclovir for herpes simplex virus meningitis. In this case, when we see the case of meningitis, we have to report to the public health first of all, and it is so important. And here losing, it should be emphasized, and it is it's crucial to know about that the hearing test is so important to do also, because hearing loss is one of the complications of the meningitis.